Hey, everybody, it's 4 o'clock on Thursday, time we get together to remember that we're going to get through this. We're going to get through it together. One of the reasons we're going to get through it is so many organizations out there, so many educational institutions doing the right thing, masking up, protecting one another. This is the Murray State Racers. Thank you to Bob Jackson and the whole administration there. Going to start today with good news. We have another big COVID day. We're in the middle of a surge. We have to take action, but we also have to keep our mental and emotional health up. And one of the best ways to do that is to talk about the good things that are going on out there. So I want to start off with a project in Pikeville. So the AML pilot program awarded the city of Pikeville a $6 million grant in the 2017 grant cycle to build a speculative building, a spec building in the Kentucky Enterprise Industrial Park. Almost $4 million has been expended of that $6 million grant. The spec building grant was approved in June of 2019 and received authorization to proceed in February of 2020. Construction is going well, and the building is expected to be finished in the spring of 2021. City of Pikeville has recently announced that Wright Concrete and Construction, Inc. of Pikeville will lease the building, which will serve as a headquarters for its more than 20 businesses. The full-service commercial contracting company offers a number of services, including all concrete work, equipment rental, mine sealing, drilling, and pumping. The company has said that its move to this building will immediately create 40 new jobs, with 20 additional jobs planned in the near future. I and Cabinet Secretary Rebecca Goodman are committed to the values of promoting economic development in communities that haven't received the share of attention and really results that they deserve. This program has brought a good measure of economic vitality to Eastern Kentucky and is another example of how we're going to work to continue to use any source of funds to create new jobs and new economic vitality in all parts of this state. Earlier this year, we announced the funding of two other AML pilot programs, the Paintsville-Johnson County Economic Development Grant Sewer Expansion Project and the Troublesome Creek Environmental Authority Drone Port Water and Sewer Collection Project. Again, these are committing to a better Kentucky, not just building back to our old normal, but building better. I want to acknowledge Congressman Rogers, who has championed $540 million in federal funding for this program that has allowed for this success in Pikeville. It's one thing to make the commitment to a spec building through a program. It's another when you have an announcement that it's going to come to fruition and create jobs. We're excited about the economic development opportunities and successes that are occurring right now. Suggest to us that there's an opportunity to not just bounce back, but really sprint forward coming out of COVID. All right. So the next piece of good news is a really important one, and it's going to help out those that are out there fighting some of the most important fights. So every day, we are in the honorable position of being able to serve Kentuckians collaboratively with our partners, volunteers, and families who represent the Commonwealth. We're happy to announce substantial funding, $1.4 million from the Coronavirus Relief Fund to three partners to the Cabinet for Health and Family Services. These are partners committed to preventing abuse and domestic violence. They do this by providing survivor resources and community education and advocacy training. These three crucial partners are the Kentucky Association of Sexual Assault Programs, that's KSAP, the Kentucky Coalition Against Domestic Violence, and the Children's Advocacy Centers of Kentucky. Three incredible organizations helping those in crisis and being there for people maybe at their very lowest moment, ready to start the healing, even while in many of these instances we are seeking justice. All have a presence across our entire state, and they're going to share these dollars. Funds will be used for costs directly incurred as a result of this COVID emergency. So PPE and all expenses to improve telecommunication services to their clients. These groups, they play such a pivotal role in the healing of trauma, of abuse, and partner violence that far too many Kentuckians experience. And as families face the stress that COVID creates, joblessness, illness, social isolation, We're relying on these groups more than ever to be able to reach people when maybe it's a little more difficult to do so. They've devoted time, energy, and funding to ease the pain of others. They haven't been able to fundraise as usual, so they do welcome volunteer assistance. So with this award today, we're helping the helpers. These people are doing God's work. We appreciate them so much, and we know that our faith compels us to help those who need it the most, and these individuals show up to do it every single day. All right, another piece of good news is updated guidance from the CDC. And you know what that says? It says the same thing that we have been saying, that wearing one of these masks not only keeps you from spreading the virus to others, but protects you. So the Center for Disease Control and Prevention released additional guidance that supports mask use, saying facial coverings can protect both the wearer and those around them from COVID-19. So with cases surging, wear your mask, it protects you. The agency cited several studies that found facial coverings reduced transmission of the virus by more than 70% in various instances. Think about everybody wearing a mask and having a 70% reduction in the spread right now, what that would mean. CDC also says that adopting universal masking policies could help avert future lockdowns, especially if combined with other non-pharmaceutical interventions such as social distancing, hand hygiene, and adequate ventilation. So this is the CDC saying the mask mandate is the right thing to do, but if everybody follow it, we could have a real reduction in the spread of the virus. All right, and I want to point out a couple of groups that are out there masking up, doing the right thing, and even changing the way they go about some things. So we want to continue to applaud those that are doing it right, who are following the recommendations and doing their part to stop the spread of this virus. And we have managed some success and some wins along the way. Let's go to the next one and then we'll come back. Rockcastle County is in a red zone, but students and teachers are still finding ways to engage and participate in academic competitions. This past weekend was the Kentucky Association for Academic Competition, and the state finals are the Governor's Cup. Instead of competing at school, these Rockcastle County students competed from their homes. I know it isn't ideal after all the hard work, but thank you for your sacrifice. But still, they excelled. On Saturday, the Rockcastle County academic team won the overall Junior Varsity Challenge Championship for their section. This was only the second time in school history they've earned this honor, and they've been competing since 1986. Quick Recall team brought home first place title, and 6 students placed in individual competitions. Congratulations to all of these students who are doing it right, doing it safely, and had big time success. We are so proud of you. And speaking of our academic institutions, here is the principal of Bevins Elementary School thanking Pikeville Public Library for their donation of these beautiful handmade children's masks for our students. We see a lot of difficulty, but so much kindness out there. And these coverings for kids truly go a long way. So thank you to the library. Thank you to Bevins Elementary School for being out there and doing it right. So that's our good news. Our bad news is this virus continues to spread at such an alarming rate. Today, we're announcing 2,342 new cases of the coronavirus. And when we say cases, these are people. These are 2,342 new Kentuckians infected with this virus. 2,342 of our neighbors, friends, people across this Commonwealth, people that could have been us, infected with this virus. It's the third highest day that we've had, and includes 274 kids. Brings our total number of cases now to 129,680. You know, it feels just the other day that we were going over 10,000, and here we are at almost 130,000 cases. Positivity rate now 8.29%. Now, we keep saying that this is the highest rate since May, but remember in May, we didn't have the testing we have right now. This is a high positivity rate with an abundance of testing, which means that the virus is at an all-time high in its spread. Remember, more cases mean more hospitalization. Today, 1,311 Kentuckians in the hospital with COVID-19. That's up from 1,274 yesterday. A couple more people in the ICU, 299, and 163 on a ventilator. That was 151 yesterday. All of those are COVID related. New cases by county. It's a really long list because sadly, there is a lot of this virus. Jefferson County continues to be hit really hard with 507 new cases, 285 in Fayette, 86 in Christian, 64 in Kenton, which got hit hard yesterday as well, 58 in Warren, 56 in Boone, 47 in Davis, 43 in Jessamine, 41 in Campbell and Hardin, 33 in Carter, Laurel, and Shelby, 31 in Pulaski, 30 in Barron, 29 in Monroe, 27 in Nelson and Oldham, 25 in Bullitt and Madison, 24 in Floyd, Franklin, and Greenup, 23 in Henderson, 22 cases in Ohio, Rowan, and Taylor, 21 in Johnson County, 18 in Callaway, Marshall, and McCracken, 16 in Lewis, 15 in Logan, Marion, and Woodford, 14 in Hopkins, 13 in Bath, Boyle, and Scott, 12 in Casey, Graves, Mason, Mercer, Pike, and Whitley, 11 in Adair, Boyd, Lincoln, Montgomery, and Wayne, and 10 in Hancock, Hart, McCreary, McLean, and Morgan. And I think every other county has at least one case, but I just read the name of just about every county. That's how widespread this surge is. So remember, the more cases we have, the more hospitalizations, the more people in the ICU, more people on a ventilator, and the more people who don't make it. So today we're announcing 18 new COVID-19 deaths. 18 is far too many. And it hurts to read 18 names or entries. Today includes a 77-year-old man from Allen County, an 86-year-old woman from Christian, a 66-year-old man from Clay. I believe we've had back-to-back days where we've lost somebody from Clay County. A 75-year-old woman from Clinton, 2 from Henderson, both 75-year-old men, 2 from Jefferson, a 96-year-old woman and an 89-year-old woman, a 76-year-old man from Lee, an 80-year-old man from Lincoln, 2 men, one 90 and one just 57 years old from McLean County, 78-year-old man from Oldham, 2 women from Pike County, a 68-year-old woman and an 86-year-old woman, and an 82-year-old man from Pike 2, a 70-year-old man from Rockcastle County, and a 93-year-old woman from Rockcastle County. To those that we have lost, we will do better. We owe it to you, and we owe it to your families. So continue those green lights, continue ringing those bells. We're going to, even if we start turning things around right now, we're going to have substantially more loss as we move forward because, again, we got to slow down the spread. We got to stop it. We got to turn it around. And already with the number of cases we've had, we know we're going to lose a lot more people. So let's do our part to make sure we don't lose any more people than we have to. And remember, these folks are more than ages and counties. They're real people. So yesterday we thanked all our veterans on Veterans Day. Their service is truly inspiring. Today we want to honor one veteran that we tragically lost to COVID-19 on October 23rd. John Vereb from Mount Washington was only 52 years old when he passed away, leaving behind his wife Angela and their 3 children, Harrison, Connor, and Alina. John served in the U.S. Army from 1986 to 1989. Thank you for that service. Afterwards, he started serving his community in a new way as a certified emergency nurse. He worked in the emergency departments of University of Louisville Hospital, Norton Hospital, and Baptist Hospital, and he taught students at Spencerian College and Jefferson Community Technical College. He was also a tireless advocate for survivors of sexual assault. John's career was brought full circle in May 2019 as he began to work as a nurse manager for the Department for Veteran Affairs. In response to the COVID-19 pandemic, John was detailed to the emergency department at the VA Medical Center in March, where he often treated COVID-19 patients. On October 11th, John was diagnosed with COVID-19, and he died just 13 days later. John was proud to serve his country and his fellow veterans. To honor John, his family asked that Kentuckians do their patriotic duty to protect themselves and others by wearing a mask and social distancing. It is a small sacrifice to make for those on the front lines who serve you. As we honor John, now a double hero, and all our veterans, we also want to thank our healthcare workers who are serving our veterans at this time. Dan Melcher, whose wife Dana works at Thompson Hood Veterans Center, told us how proud he was of her and her team for continually stepping up during this crisis. He sent this picture of the staff from before the pandemic began so veterans and their families could see the faces of people who are taking such good care of them. Dan, thanks for helping us recognize those individuals. Can we go back to John? To John's family out there, thank you. Thank you for sharing him with us. His sacrifice, both serving our country and serving those in need during this COVID crisis, is nothing short of heroic. To his daughters, your dad's a hero, and the way he lived and the way he died. And you all are heroes too, for being willing to speak out about your loss at a time when I know it is most painful, in a way to try to help others not have to go through what you are going through. We here in Kentucky, we love you. We want to help you in any way we can in these difficult times. But thank you for sharing John with us during his time on this world. I know he has gone to a better place. You will see him in the future, and I know he earned his spot there in heaven. So folks, wear your mask. Today, I'll wear mine for John, his family, his 3 daughters, his wife. That's the least we can do with all the sacrifice that he made. All right, today is when we release the new red zone counties. You want to show the map first. It's probably not unexpected. But as this virus has only increased this week, the number of counties that fall in the red zone have increased. So today, we're announcing 94 counties qualifying in the red zone. Certainly 2 new counties from last week are Franklin County here, Woodford County, and a number of others. Remember, what this is supposed to do is to provide a way for these communities, 94 of them, to come together with government, business, school system, everybody, long-term care, working together in a unified effort to stop the spread of this virus. The biggest employer in Franklin County is the state, and we will be following the red zone recommendations next week. Everybody who can work virtually is going to be working virtually. Any service that can be done virtually that doesn't have to be done in person next week is going to be done virtually. And that should be the case in each and every county that we operate in. We're going to live up to what we're asking other people to do. And we're asking this county, Franklin County, to work with us, like I know that they have. But this type of effort needs to occur everywhere. So let's put up the red zone recommendations if you have them. Remember, if you're in these counties, you shouldn't be doing gatherings at all, not outside your immediate family for this next week beginning on Monday. School should be virtual to help us tamp down the overall number of cases. We're asking our employers to let people work virtually. We're asking people not to travel and to try to cut down on their contacts. If you're in one of these counties, support your local businesses. Please do it. But as much as you can, order takeout or carry out or curbside. And if you're going to go in an establishment, support those that are enforcing the mask mandate and doing it right. It's really important that we reward those groups that are having the courage to do the right thing, even when it can be hard. A lot of counties, but it means now's the time. This is the way that we avert more serious steps. We need to step up and get it done. We'll turn it over now to Secretary Eric Freelander, who has an update on pandemic EBT that I know as families have been waiting for and is critically important during this time. Secretary?
Thank you, Governor. Yesterday and today, I wear this mask for our veterans. They protected us. It's the least we can do to protect them. So today I'm here to talk about pandemic EBT benefits. They've been a little slow to get out. And let me remind you what pandemic EBT benefits are. Those are the benefits that are provided for school children who are in free and reduced meal schools and who receive free and reduced meals. And this is to make up for those meals that they miss while our schools are in NTI. So this new card we are sending out and have sent out. We were trying to get out beginning in about the middle of October. We have a vendor. Their name is Fidelity Information Systems, and we have been working with them to try to catch up. We actually heard through some Facebook groups that there were cards, they hadn't seen the cards. And so we followed up with our vendor, and it turned out that in the beginning of November, there were only about 3,000 cards that were out. Well, I'm happy to report that as of today, we are almost to 500,000 cards that have been sent out and are being distributed. So within the next 2 to 3 weeks, everyone who is due to get a pandemic EBT card should be receiving it. No need to re-enroll. Those folks who are eligible have been auto-assigned and auto-enrolled in the program. So we have, in terms of what's been distributed thus far, we have about another 175,000, 180 cards to begin that distribution process, but we have made great progress since the beginning of this month. So hang in there. It's on its way. And we hope to have all of these cards distributed by the time we said we should, which is by November 20th. We have been assured that that's going to happen. And so I'm hopeful that we will get that done in that time. And lots of hard work has gone into that, both on the part of our vendor and on the part of the state workers who we in DCBS found out that there was an issue and addressed it, and hopefully have made that, we're going to make that good. So I'm happy to announce that. One other thing I want to talk about, we are seeing, as the governor has described, this spike in our cases, this increase in our cases. And we've been asked a couple of questions about what else can we do, particularly within our long-term care community. On Monday, we are going to provide some additional guidelines. And remember that we finally have some real hope on the horizon around what is happening with some of the vaccines. We know that they are being developed. So we have to practice patience and persistence. We have to make sure that we're protecting each other and protecting our seniors while we bridge to now a place where we know that's going to be, a vaccine that's going to be effective. So we have to redouble our efforts. We have to be patient and persistent. We also are working with our National Guard to make sure that we can provide some additional support for our long-term care facilities. We'll have more on that on Monday, but I just want to let everybody know that we are working very hard to protect our seniors and give as strong a guidance as we can to make sure that we're able to celebrate future holidays with them. Governor, thank you, and I turn this back over to you.
Thank you to Secretary Friedlander. With that, we will open it up to questions. I'm going to start with a written question from Chelsea Jones at WKYT. Health officials have been saying that many recent COVID-19 cases are coming from family gatherings. Do we have a breakdown of percentages of cases that are from family gatherings, business settings, restaurants, et cetera? Well, we don't have a percentage at the moment because there are so many outbreaks that contact tracers are frankly overwhelmed. But in just the past month, there are identified outbreaks in Kentucky that have been traced to weddings, meals with friends, funerals, friends meetup, family socializing events, a birthday party at an out-of-state trampoline park, in-state birthday parties, families who have met up at an out-of-state cabin, a Halloween haunted trail event, and an out-of-state disaster relief mission, and other activities. Also in the past 30 days, a number of clusters related to restaurants or businesses of various types. With these red counties, we see so much spread that it's really the amount of time that our contact tracers have, how many they get to, that gives us the information that we have. Now, I will say, though, that this isn't just something we see in Kentucky, and it's not just anecdotal. We are hearing it from the federal government, and we are hearing it from all of our neighbors surrounding us. But a number of examples that again tell us that Thanksgiving, if we don't do it the right way, can end up really dangerous. Thanksgiving is a meal with family. Thanksgiving, oftentimes we act around each other like a birthday party, family that is close, that ultimately takes their masks off, eats, and does the other things. We do not want Thanksgiving to harm people we love this year. All right, with that, we'll go to Stu Johnson from WEKU.
Thank you, Governor. With the word from the CDC about the importance of mask wearing and protecting the wearer as well as protecting others around you, and with the exception of the individuals that are in hospitals and being cared for in facilities, is that a way of saying that the community spread is primarily happening from individuals not wearing masks?
Well, certainly there is more spread that occurs when people are not wearing masks than when they are. And when we look at these, the examples I just gave, Stu, it's almost always where people have taken off their masks. We don't see many examples of spread where both people wear their masks. And listen, I'm living proof of that. Having ridden in a car and the passenger side seat next to somebody driving that was positive and infectious at the time. CDC also did a study on two stylists that were positive but were wearing masks that did not infect any of their clients. So yes, we are getting community spread at events or gatherings or different things where people aren't wearing masks. And with this level of COVID right now, if you don't wear a mask, it's just a matter of time until you're going to get the virus. Now, maybe you're tough, or maybe you don't think it's going to harm you, and maybe it won't. But that also means you're willing yourself to be a carrier to see who else doesn't get it. Some experts have said that one person who is positive, who doesn't take steps or wear a mask, can infect up to 400 other people. So don't be reckless. Do your part. Josh James from WUKY.
Hi, Governor. You've said the state's problem now is not so much mandates, but compliance with existing mandates and recommendations. Does today's Supreme Court ruling move the needle at all on the steps you're willing to take if the surge continues to worsen?
We weren't waiting on today's Supreme Court decision. Now, it's certainly a positive decision. It says that we have acted in the best interest of the Commonwealth. It reinforces that a statewide approach was necessary and that all of our actions are constitutional, and that this is the job of a governor. I'm grateful for that ruling because it means that we can continue to protect people. But we weren't waiting on that ruling to act or not to act. where we truly are right now is we've got to get more buy-in from people for current mandates or later ones to work. But if you look through steps that other states are taking, New York just reduced gatherings to 10 or under. Well, we were already there, and certainly our recommendation is even lower. It's no gatherings in red counties. When we look at what Indiana and Ohio are doing in some of their higher counties, they're reducing restaurant and bar capacity to where we already have it. So a lot of things that people say are new going on around the country, we have already done. We have been, I don't want to say we've been more aggressive. I just think we've been responsible. And then we have to really look at, does taking any additional step where we are right now versus other people coming down to where we are, does it give us additional compliance? Does it give us additional effectiveness? Because effectiveness is best practices. They can be rules, regulations, recommendations, times the number of people who will follow them. So we're always just looking at overall effectiveness. Debbie Yetter from the Courier-Journal.
Hey, Governor. Do you all have any recommendations for college students likely to come home at Thanksgiving? I know some schools are recommending the students be tested. Do you think they should even be coming home for Thanksgiving?
Well, I know that some universities are trying to wrap up their in-person classes before Thanksgiving, realizing that either students could bring it back to their community or could become infected and then bring it back to the university. Certainly, if you are going to, if you are currently at a university, which means you're just in a different community, and you're going to spend a significant time back at home, get tested before you go home, get tested before you go back, give yourself a specific amount of time where you can cut down on those contacts, and then just be very careful during it. And let's think about those family gatherings. You know, kids coming back to their parents, that's going to happen. But then think about grandparents and how much we increase the risk, especially of those additional contacts and mixing those communities. So we need Thanksgiving to be small. We need Thanksgiving to be just your household. And that's not trying to dishonor or disrespect Thanksgiving. We love it. But in giving thanks, let's give thanks to the knowledge of how to protect those around us. Tom Latek from Kentucky Today.
Good afternoon, Governor. With the Supreme Court decision and the increased cases in more red counties now, does this give you any impetus to change some of your recommendations to mandates?
I don't think we're there yet, Tom. You know, we are trying to see right now how well these work, how embraced they are by the communities, and we are seeing some real significant buy-in, and we are seeing cities and counties step up to enforce it. You know, one of the things the Supreme Court told us is that these executive orders, they have the force of law. Remember, they weren't just brought by the Attorney General; they were brought by different groups that are supposed to be following mandates and that didn't want to. One was a type of restaurant. One was I think a speedway, and then there was a daycare too. So what this ought to do is tell both state and local officials that these orders are absolutely enforceable, and that allows us to have confidence to step up that enforcement, which really we need much more on the local level, but we're starting to really hear from communities about doing it. John Boyle from WFPL.
I wanted to get a reaction from across the river. We saw Governor Holcomb reel in his stage 5 and just talk about some things that they're going to be doing differently. So as you know, a lot of people from the Louisville area simply just cross the bridge over to southern Indiana communities like Jeffersonville, New Albany. So I wanted to hear your thoughts on that kind of reeling in of restrictions in Indiana and any sort of impact it might have on Kentucky.
One of the challenges we have in Kentucky is that many of our bordering states have not taken the same steps or to the same degree that we have. Certainly, Indiana and Ohio have taken significantly more steps than Tennessee and Missouri, but we have kept more restrictions in place, which if you look at our overall numbers, if you look at our positivity rate, if you and you compare them, I think we made the right decision. But listen, we are better off when others are doing are reeling in, like Indiana and like Ohio is talking about doing it. Everything that they do right now to address their surge should help us. You see, not just in the Louisville area, but in the Evansville, Henderson, Davis County, Union County area, red counties in Kentucky, right across the river from Indiana. Now, almost all of our first red counties were on the Tennessee border. So yes, we need our bordering states to step up their actions. Indiana is doing it. Ohio has been doing it. We need it from others too. It's also one of the reasons why I think we need a national mask mandate. And it's something we shouldn't have to have because everybody should be doing it. But if it protects the people on the southern border of my state, which I'm charged with protecting, then I'm for it. Melissa Patrick from Kentucky Health News.
Hi, Governor. I have a question about the CDC's new ruling today. What do you have to say to people who say that the CD rules keep changing? So why should I even listen to them?
What I'd say is this virus didn't even exist until the end of the year or the beginning of the year. And to suggest that the CDC knows everything that you should do to fight a virus that it's never seen before we treat it, before we learn how it spreads, before we have studies on how to better stop it, would be like me giving a fifth grader calculus, giving them no time to learn how to do it, or to get the ability to do it, and then get mad at them if they can't do it. I mean, we got to understand that when we have pandemics, they are viruses we haven't seen before. Otherwise, we can deal with them. So, Melissa, I get the question. I get people saying it, but a lot of it is about rationalizing out of doing something. So if the CDC now knows from their studies that you can reduce the spread by 70% and protect yourself wearing a mask, why the heck argue if they should have argue that they should have told it to you 4 weeks ago, but because they didn't, you're not going to wear one? Science has changed significantly over the last 10 years, and we're not fighting something right now because 10 years ago we didn't know it. So let's just follow the good advice that we get as we learn more. All right, written question. Ohio's governor announced yesterday that if things don't improve, he'll consider shutting down bars, restaurants, and fitness centers again. Will you consider doing anything like that if Kentucky keeps seeing record cases? Well, listen, we're following it closely. We are committed to taking actions as we need to. Right now, we are monitoring the red county reduction recommendations. We're going to see how those work. What's the status of the field hospital? We don't think it needs to be up yet, but we are seeing some strain on a number of our hospital systems, so we are monitoring it very closely. But let me remind you that we can give you the numbers on total number of beds, their occupancy, the percentage with COVID patients. But we're going to run out of nurses and doctors before we run out of beds. And so we've got to watch that strain. And it's real. And we're at least seeing some signs that our hospital system could become overrun. And we'll be ready at the field hospital. We'll be ready to provide additional help. But the only way to truly prevent that from happening is to lessen the number of cases. We'll do everything we can to deal with it if it comes. But if our cases keep increasing at the rate they are right now, we will end up overrun. You're seeing that in other states. All right, we'll go back through very quickly. Stu Johnson again.
Yeah, Governor, I guess following up on that last question about bars, restaurants, and gyms, and businesses certainly probably wouldn't like to hear this, but has there been any consideration given to maybe a 2 week shutdown back like earlier in the pandemic, and that might give a chance to break the spread somewhat?
So right now we are not considering any full shutdown of any industry. If we get to that point, it would certainly be limited in duration. Our Red County recommendations, are week by week, but we want to make sure that we are very thoughtful before we go in that direction. And remember, we shouldn't have to if people will do the right thing and if businesses will enforce it. So a lot of it is it's all in the hands of Kentuckians to do the right thing. So we don't have to consider those options. Josh James.
You just mentioned the possibility of rebooting the field hospital in Louisville, but in Lexington, UK Healthcare is sounding confident they have the capacity and staff to handle a surge without reopening the temporary facility they set up earlier this year. I was curious how well prepared you feel Lexington is and whether you would like to see preparations for a field hospital here as well.
But we are better prepared to handle this surge than we have been at any time during this pandemic. We are significantly more ready than in March and April when we saw some staggering loss in certain places that were running out of hospital beds. We didn't have the types of treatment that we now know work fairly well. We didn't have the type of testing that we needed at the time. Even as compared to the July period, we are better prepared now in terms of PPE. I believe that Lexington is ready. Part of the reason that they are ready is that their hospital systems and others around the state are working so well with each other and are showing a willingness to move patients if necessary between them. As long as that's the case, I think we do have a lot of capacity. But again, the best thing that we can do is what it takes to tamp down cases, because we can be as ready as we can be. And I think we are pretty ready. But if our cases continue to increase the way they are, now we're going to see what we see in other states where they pull up the refrigeration trucks. And I never, ever want that to happen here in Kentucky. Debbie Yetter.
Have you all thought of any other way to reach the public about the mask situation and other precautions? I was at an interstate rest stop yesterday where people were just breezing past the sign telling them to wear masks and going in without masks.
We are always trying to, and we will take any suggestions. One thing we're seeing as being particularly effective is having our healthcare workers speak directly to individuals, oftentimes through the media. You take our hardworking nurses on a COVID wing or in the ER. They've been at this for months upon months upon months, putting their lives on the line. We lost one that we talked about today. And we call them heroes and we say, thank you for what you're doing, but do we do our part to truly honor what they're doing? And the more that we can hear from them, wear a mask for me and my family, as opposed to hearing from the governor saying, put on your mask. I think the more effective that it is. But at this point, we're open to anything that would convince folks out there. Earlier today, I said my hope and my prayer is that those who have been wearing masks routinely have the resilience and the strength to continue doing so. That those who wore it in the beginning and are struggling now get a breath of new energy, step up, rejoin this team in full, and help us get to that vaccine. And those that are refusing and maybe even are sometimes angry about it, I hope they have a change of heart. I hope that their faith and their values speak to them and say that there's a time to be stubborn, but then there's a time to care for your neighbor more than the point that you want to make. Tom Latek.
All right, thank you, Governor. You've spoken about the local governments buying into this. Have you ever gotten any figures on how many warnings and citations have been issued to businesses who are not following the mandates and recommendations?
We have those numbers from our labor cabinet. I don't think we have them from local governments, but we'll get you those numbers from the labor cabinet itself. The other places you turn to first are Louisville and Lexington, because they have their own inspectors, for instance, in ABC. And so they'd have some statistics too, but we are seeing, and it's relatively new, a lot of our other communities, smaller communities, at least compared to those two cities, that are ready to step up and issue citations, warnings, and even closures if that's what it takes. John Boyle.
Hi, Governor. I wanted to go back to the hospitals discussion. We've been mentioning the strain caused by staffing, and even with that particular type of strain, as opposed to strain on beds, has it popped into your brain that you might have to ask hospitals to postpone scheduled surgeries and other types of procedures just to give a little bit of relief to these hospitals as we see COVID-19 numbers rise?
John, I don't think we will have to this time around, because they're doing it on their own when they're starting to get there. We've just seen a really responsible reaction, both during July when certain regions were getting there, and right now where there's strain in certain systems. We'll monitor it, but this is, we got a lot of positive stories out there, from testing to PPE, but the responsibility that these hospital systems have shown, knowing that dealing with COVID is their calling too, has been pretty incredible to watch. So we'll continue to watch that, but we're seeing these groups do the right things as their strain grows. All right, Melissa, Patrick, you want to ask our last question?
All right, thank you. So there's been some recent stories written about rural hospitals not being able to afford the $10,000 to $15,000 freezers that will be necessary for the Pfizer vaccine that requires ultra cold storage. And there have been some rural health experts that argue that rural people need first dibs on these vaccines because they have high elderly populations and high populations of people with chronic health issues. So what's Kentucky's plan to manage getting this very first vaccine to our rural population? And is there any CARES Act money left to help them out?
So we're working through this right now. Let me start with your last question, though. The CARES Act money all has to be spent by December 31st under its current version, meaning there are $0 in January when most of the vaccines will be out there, meaning the logistics of getting the vaccine out by states is not going to be funded after December 31st without another round of CARES Act funding. So people may argue what should or shouldn't be in another CARES Act funding, but this has to be a piece, and I appreciate you bringing some attention to it. We're working through these intense refrigeration units right now. The state has several. We certainly have holding locations with some of our major logistical partners, and we're also watching the development of other vaccines that may be out by the time we can push it out very widely around the same time, and may not require the same amount of refrigeration. But I can tell you, in our planning stages, we're going to make sure that this isn't just available in urban settings, and we're going to have a little bit of time, because the very first vaccines that come out, we're going to make sure we get, for instance, to our healthcare workers. And then you're right, we need to get them to those that need them the most, that are the most vulnerable. And we're going to make sure that happens in rural populations just as soon as it happens in urban populations. And there are more than just hospitals that are out there that have different regional centers that may or may not have this type of equipment. There are some of the folks that we've worked with on testing, and we're going to make sure that we get it right. But that is still work in progress. But our rural communities have my commitment that we are going to get that vaccine out there. And if it holds at 90%, hallelujah. The end, we can see. It may not be right here, right now, but how good does it feel to at least have hope that we can see the end. And we're going to make sure that hope comes for everybody who's willing to take that vaccine. All right, our next live briefing will be 4 p.m. on Monday. But remember, 94 red counties. We have a lot of work to do, and we have to get it done. The lives of our neighbors and our friends depend upon it. Our economy and how quickly it can bounce back depends on it. So please wear your mask. Wear them for all the veterans we've lost right around Veterans Day. Wear it because it's the right thing to do. Thank you all very much. All right.